attempt to have an athlete's body, we frequently wind up with athlete's feet. Not just rashes and inflammations, but blisters, bruises, and pain. Whether you jog, walk, or grab a racket to keep in shape, oh, your feet take a beating. So it's no wonder that many of us suffer from foot ailments. But they can be averted if you're well equipped. Not just with the right footwear, but you've got to have the right information as well. And that's where Dr. Sheldon Nadal comes in. He is a Toronto podiatrist and his career stands on feet and what ails them. So for the next few minutes, why don't you just put your feet up and dial 872-CFTO with your problems. When we come back, it's Feet First with Dr. Nadal and more. The subject is feet. The expert is Dr. Sheldon Nadal, and we're talking about sports injuries, those terrible things we do to our feet while we're trying to keep in shape, how to avoid them, or if the inevitable happens, how to treat it. And 872-CFTO is all you have to do with your finger in the telephone to put yourself in touch with Dr. Nadal. And you were here a little while back, and we got into the discussion, and there was so much to talk about, we sort of postponed the rest of it. And maybe we'll just sort of run over quickly what we talked about then. You were talked extensively at that point about correct footwear, that's right. One important thing, and maybe you can just reiterate what you said.
What we said was stretching is very important, and having the proper shoes is very important. If you stretch properly and you wear the right shoe for the right sport, and if the shoe is in good shape, you're going to avoid a lot of injuries. If you don't stretch, if your shoes are worn down, that's when your feet and your legs are going to start to hurt.
And different shoes have different constructions.
That's correct.
You brought my favorite.
Yes. This is a basketball shoe. It's big because it's my foot.
You got a lot of shoe for your money.
That's right.
Considering the person who wears a size 7.5 pays the same amount for that.
That's true. Now, this shoe has what's called lateral foxing, which is this support on the side, and that allows you to go from side to side. A straight running shoe that allows you to go forward and backward won't have this. If you play basketball or tennis in a regular running shoe, you'll hurt your foot. Another important part of the shoe is the counter, which is the heel, and this should be very firm to help support the foot. And most good sports shoes should have at least 2 layers of sole, a hard outer sole so that the shoe doesn't wear down, and a softer inner layer to absorb shock.
For any sport.
That's right.
So those are the areas we should be focusing on when we're buying a shoe, is the side, the sole, the thickness of the sole and what it's made of, and the counter are the most important areas.
One other thing that's important is it should be flexible at the ball of the foot, because that's where your foot bends.
For any sport?
For most sports, that's correct.
Except a cycling shoe, I guess they're
that's
supposed to be
different.
Stiff. Okay, and do keep in mind, we can't stress how important it is to know that they're built for different sports. The shoe that's built for lateral motion in a racket sport is not what you want to wear for forward motion if you're running.
That's basically right. If you can afford it and you're really into a sport, you should have the right shoe.
What about cross-training shoes?
They can be okay, providing it has the proper support and it gives you the shock absorption that you need for your sports.
And a cross-training shoe is a shoe that's designed to take you through more than one sport so that you can avoid laying out all that money if you're doing 3 or 4 different things.
That's right.
Another contributor to foot problems is mechanical.
Yeah, if your foot isn't mechanically balanced properly, then you can run into various injuries. One of the more common ones are heel and arch pain. We get a lot of people that come in with sore heels and sore arches. Classically, patient tells us that their feet hurt a lot when they get out of bed in the morning, and as they walk, they feel a little bit better after they've been walking for a few minutes. Then after resting and walking again or working out, the heel or the arch starts hurting again. And that problem is called plantar fasciitis, and that refers to a tissue that runs from the heel to the toes, and it helps to support the arch, and it's like a bowstring on a bow. And what happens is that tissue pulls off the heel, and the heel becomes inflamed, and it becomes very sore. The best friend a runner has is ice and aspirin. Second best friend is his podiatrist. If you have that type of problem, aspirin helps to relieve the inflammation. Ice helps to relieve the pain. Check the shoe, make sure it's not wearing down. And you may want to put in a slight heel lift under the heel, because that helps to relieve a lot of the strain.
And when you say aspirin, you do not mean acetaminophen because it doesn't have the same anti-inflammatory
That's
capacity.
right. If you can take aspirin, it has an anti-inflammatory component. It affects some people's stomachs lining. If your stomach bothers you, then you shouldn't take it. But otherwise, if it doesn't bother your stomach or your bowels, it's much more effective than acetaminophen or Tylenol.
Okay, let's get to the phones and get Robin's question in before we go to commercial.
Hi, Robin.
Good morning.
Good morning, Noreen. I love your show.
Thank you.
I have a problem with calluses and peeling of my feet inside my running shoes. I wear cotton socks, but my feet still peel around my toes and around my the bottom of my foot at the heel.
So you like
and I know it's not athlete's foot.
So the cause and the treatment.
Okay, a lot of people may sweat excessively, and that can cause peeling. And if that's the case, Robin, you should use foot powder to help absorb sweat. Some people get a lot of cracking around the heels, and that's due to dry skin, and cream around the heels may help that. If it persists, you should see your podiatrist.
Good advice, and we have more good advice from Dr. Nadal when we come back after this commercial break, so don't go away. But your feet are aching, it somehow doesn't seem to matter, does it? What does matter is that you dial 872-CFTO to talk to Dr. Nadal about any of the foot problems that you've encountered in your athletic endeavors, because that's what this whole conversation is about. Stress fractures are a significant problem.
We get a lot of people that come in with pain on the top of their foot or in front of their shins. The long bones of the foot and of the leg have a lining called the periosteum. If it becomes inflamed, it can be very painful. On the foot, it occurs on top of one of these long bones called the metatarsals.
I've had that and it aches.
It does.
Yeah.
What happens is it gets very tender to touch and it becomes swollen. And the more you walk on it or run, the more it hurts. This is one kind of injury that you shouldn't try to run through. The cure for periostitis or stress fracture is rest, ice, and aspirin. If you continue running, the bone will actually break, that's what's called a stress fracture. That can occur on top of the foot, or it can happen in front of the shin.
Ice and aspirin.
Ice, aspirin, and rest.
Okay. Since we're talking about running, what's runner's toe?
Runner's toe is another common problem, Noreen. If the shoe doesn't fit properly and you're running, your toe may jam into the front end of the shoe, and that can cause irritation, and that can cause bruising under the toenail. And the toenail turns black and it becomes very sore.
Okay, and there are other toe problems you can encounter as well in sports.
Sure.
Other toe irritations.
If your toes are crooked and the shoe doesn't fit properly, then it will rub on top of the toe and that can cause corns. So the key to both is to make sure the shoe fits properly and doesn't press on the toes and there's enough room at the end of the toes. If you get runner's toe, often the nail will fall off. But if it doesn't and it's very painful due to a buildup of blood under the nail, the blood can be released by carefully heating up a paper clip and making a small hole in the nail, or by seeing your podiatrist.
I think I'd see my podiatrist.
Okay.
So in both of those cases, you're going to have to replace the shoe to get rid of the problems.
The shoe must fit properly.
Yeah, okay. Yasmin, you have a question, and we'd love to hear it.
Okay. I work out on a treadmill, and I don't run on it. I walk on it at about 4 miles per hour. And I find if I put the incline mechanism up above 3%, then the outer portion of the ball of my foot starts to ache. And I'm wondering if that's related to the shoe or the inclination level.
I think it's related, Yasmin, to the inclination and to the fact that you may have tight calf muscles. In order to walk up an inclination or an incline, the calf muscles must be stretched because the foot must move up. If the calf muscles are tight, then the foot has to bend more at the ball of the foot, and that can cause pain at the ball of the foot, which we call metatarsalgia. So I'd recommend that you stretch your calf muscles. If you persist in having pain, you may try putting a pad in the shoe behind the sore spot to take the pressure off the spot. And if it continues, you should see your podiatrist. You may need something in your shoe, an insole called an orthotic, and it looks like this. And it can be helpful for many different types of foot problems. If your home treatments don't do the trick, this will often help a lot of different foot injuries.
Maybe just tip it to the side and we can sort of see. There we go. The thickness at the back. And then you brought another sort of, I guess that's an orthotic as well.
Well, this is a Spenco insole, Noreen. This is a fairly inexpensive material that you can get in a lot of the running shoe stores, and it's very flexible and it absorbs a lot of shock, and this can help to relieve a lot of foot pain.
So we could try these sorts of things on our own, but if it persists,
I would
get to a doctor.
try the lesser expensive treatment first, and then if you continue to have pain, you should see your podiatrist.
Okay, we've got about a minute left, and I think, Robert, we can squeeze you in here.
Hi, good morning, Noreen.
Good morning.
Good morning, doctor.
Hi.
I have a question here. I want to start running again for pursuit training for the police force. And my problem is I get this, I don't know if it's the periostitis that I'm suffering from, but I get this sharp pain down the shin of my foot, and my foot along the top, just going into the top of the foot there, starts to cramp up after a while, and I have to stop and stretch it. Is there a kind of shoe that I should buy, or something like a special shock absorber in the shoe?
All right, just as Dr. Nadal starts to answer the question, I should let you know how you can get in touch with the good doctor should you need a consultation. We'll put the address and phone number up on screen for you. You'll find him on Eglinton Avenue East, and there's the phone number. While they're making note of that,
okay, Robert, I would use ice on your shins. It sounds like you have shin splints, and make sure there's proper shock absorption in the shoe. And the other thing is stretch your leg muscles. If you continue to have pain, then you should see your podiatrist.
Thank you, Dr. Nadal, for making us more aware of the damage we do to our feet, how to avoid it, and how to treat it.
My pleasure.
Thanks. See you next time you come in.